Seemingly overnight, belly fat shows up as an uninvited guest and camps out in your lap. As easy as it slips under your belt, getting it to go away is more of a challenge. So, what causes it and what cures it? Stay tuned to this episode to find out more.
I'm Dr. Vicki Petz Casper. I practiced obstetrics and gynecology for 20 years until I landed on the other side of the sheets as a very sick patient. When my own body betrayed me, I took a handful of pills to manage my disease and another handful to counteract the side effects. My health was out of control. Through surgery, medications, and lots of prayers, I regained my strength only to face another diagnosis. My doctor challenged me to make radical changes through lifestyle medicine. Now I feel great and I want to help you make changes that make a difference. Healthy Looks Great on You podcast takes you to many medical schools so you can learn the power of lifestyle medicine. If you're ready to take control of your health, you're in the right place. Whether you're focused on prevention or you're trying to manage a condition, I'll give you practical steps to start your own journey toward better health, because healthy looks great on you.
This is episode 171, Belly Fat, Causes and Cures. I'm going to be honest. Speaking openly about belly fat feels like tiptoeing into a scene from the movie Encanto. Fears about making misfortune come true leaves everyone whispering, "We don't talk about belly fat." Here's the deal. I never want anyone to feel body shame. In fact, I invited a guest on the podcast soon who will speak to that very topic. But personally, I'm naturally petite, and that doesn't mean that I don't struggle too. Here's my story, and I'm sticking to it. Big Pharma made me fat. Steroids made me fatter. A book changed my identity, and the scales have been pretty stable for 30 years. Not necessarily in that order. And here's the deal. Healthy is my identity, even when my walk doesn't match my talk. Turns out you can know a lot, and it doesn't do any good unless you take action. We aren't really even going to many medical school today, but I do want to tell you where this term originated in my brain. I think it was during my OBGYN residency, though I'm not entirely sure. I worked so many hours during those years that it's kind of a blur of scrubs being the staple in my wardrobe, large bags accentuating my sleep-deprived eyes, and fighting a losing battle to keep my hair from continually escaping a ponytail. But around that time, the medical school I attended offered a 4-part lecture series, and they called it Mini Medical School. I talked my dad into going, and he loved it. Recently, we moved my mom to assisted living, and we've been cleaning out her house, and I actually found his mini medical school diploma. It was pretty special. But like I said, knowledge without action doesn't do a thing for your health. And in some ways, my dad didn't exactly embrace a healthy lifestyle. In fact, his lengthy medical history is probably much of what fuels me to stay healthy. That, and I like to play. My grandkids were here for Easter and we played hard. But they're 2 and 5 and they might not remember it. So I need to stay fit and strong so we keep making memories. And I'm not talking about grandma in a rocking chair memories either. What about you? What motivates you? Are you concerned about heart health, cancer, hormones, living long, or just living well? Do you want to stay healthy so you can be there for your family? What is your goal and what is your why? Those are important things when you start making changes in your lifestyle. Last week on the podcast, I shared that I lost 8 pounds in 2 weeks without willpower, and I meant it. But don't misunderstand me to mean that you can eat as much of whatever you want and then take a supplement, use a detox recipe, some weird colon cleanse, or do a bazillion sit-ups. Y'all, I have to tell you, so that I could research what people are doing to lose belly fat that doesn't work, I turned to TikTok. And the winner is a video that claims that you can put Vicks Vapor Rub on a piece of aluminum foil the size of your belly and sleep in it to melt it away. Except they said Vapo Rub instead of Vapo Rub, so they just lost all credibility in my mind right there. Now listen, my grandfather thought Vicks cured everything. He even put it in his ear when he had an earache. And you know what? He lived to be 91, so there's that. But they never once mentioned Vicks Vapo Rub in pharmacology class, and that was before everything was blamed on Big Pharma, including my weight gain. Come to think of it, they never mentioned belly fat either. But I saw it with my own two eyes. Okay, enough of that. Last week I told you it was time for your surgery rotation, so scrub up and get your gloves on. You can't touch that. You'll contaminate the sterile field. Okay, just watch. This patient has pain in her pelvis and nothing has helped. One way to diagnose pelvic pain is to take a look. We call that diagnostic laparoscopy, and here's what happens. The patient is asleep, the abdomen is prepped with an antiseptic and then draped with sterile drapes. The OR table is tilted so that the viscera, remember that term from last week, gravitates towards the upper abdomen so we can better see the pelvis. Okay, now you take the scalpel and make a small incision right below the belly button and put a trocar through the skin incision, through the subcutaneous fat, the fascia, and the peritoneum. What? You can't get the trocar in? Here, let me do it. Oh, I see what the problem is. Nurse, can you please open an extra long trocar? But putting it in that far is harder and riskier because the patient is obese. Once in place, we can take the laparoscope and look around. A laparoscope is basically a high-resolution camera on a long, narrow stick. The image is displayed up on a screen, and it can take photos too. You can't get them printed at Walgreens, but you can get a paper copy. Now here's what you're going to see. The intestines, the edge of the liver, with the gallbladder tucked up underneath, unless a surgeon's already gotten a hold of it. The appendix, again without surgeons, dangling off the ileocecal junction, the uterus, ovaries, fallopian tubes, and bladder. In a patient who does not have visceral fat, once you're past that subcutaneous layer or the little layer of fat under the skin, you won't see adipose tissue inside the abdominal cavity. But in an obese patient, there can be layers of fat on the organs, even the ovaries. Well, that was graphic and technical, and this patient is completely fictitious, but I thought you might appreciate an inside look at the effects of visceral fat. And if you missed last week's episode when I introduced you to my cadaver named Flo, there's a link in the show notes. But what causes belly fat? Well, and I say this with as much empathy as I can, belly fat is dangerous, but it ain't special. You see, the same things that cause all fat cause belly fat. I'm talking about what you eat, what you drink, what you burn, as well as some things you have zero control over, like how old you are, who your parents are, certain prescription medications that you need to take, and ladies, our dear friend, menopause. Ask me how I know. That takes me back to my story. I was a cheerleader and a gymnast in high school. Built some big old muscles. I was lean and fit despite a love for McDonald's apple pies, French fries, and an ice cold Coke. And then I narrowly avoided the freshman 15 when I went to college by about 6 pounds. During medical school, I studied all night and ate malted milk balls until my stomach hurt. But I exercised a lot, at least until I got pregnant with my first child, and then I lost most of the 35 pounds I gained, didn't gain as much with my second pregnancy, but that is when Big Pharma came into the picture and made me fat. Here's what happened. I started my practice in 1995, and back then the drug reps brought lunch nearly every day. Oh, and they brought ink pens too, but that's illegal now. But here's the deal. They brought lunch and dessert every day. Cheesecake mostly. Apparently it travels well. Every day. And I ate it. Every day. And that, my friends, is how Big Pharma made me fat. Oh, and I guess I should mention that I also drank a Dr. Pepper in the afternoon for a little pick-me-up because as an OB doc, sleep deprivation was a constant companion. And listen, I can't diet. I have zero willpower when it comes to hunger. In fact, hanger runs in my family, and that can be fatal. Not for the one experiencing it, but for those in their path. But I successfully lost the weight and kept it off for years. But hold up. Last week I told you it wasn't as simple as calories in and calories burned. And I stand by that because it's so much more complicated than an addition or subtraction equation. All calories are not created equal. But here's the deal. If you eat more calories than you burn each day, then you are more likely to gain extra weight, including belly fat. And the same is true if you drink your calories. But that isn't the whole picture. There's got to be more to it. You see, as you get older, it gets harder to win the battle of the bulge, even if you don't change your eating habits. It's pretty common to lose muscle mass as you age because, well, you're less active unless you are intentional about fitness. With less muscle, your metabolism slows down. So your body uses less calories just to sit and exist as opposed to burning them while you're at rest. Next thing you know, you've got a new friend in the front. This is especially true for women after menopause. Now, menopause doesn't necessarily make you gain a lot of weight, but boy, does that plummet in estrogen levels tend to rearrange it, and not in a flattering way either. Since this is a lifestyle medicine podcast, today we're going to talk about causes and cures for belly fat in the context of the 6 pillars. I'm going to start with stress because it brings me back to my personal story. You see, 10 years ago, I developed a severe autoimmune disease and was prescribed a high dose of prednisone, which is a corticosteroid. It was awful. I knew that with that high of a dose for that long of a time, that enormous weight gain was a risk. And I was determined not to blow up. Instead of willpower, I had a plan. For the most part, it worked. I did gain some weight, and the weirdest part was that I gained it in my face, on my collarbones, under my chin, on my back, and you guessed it, my belly. My legs actually shrunk. The reason I'm making this point is that chronic stress can lead to excess cortisol levels, which can factor into weight gain, especially the kind we don't talk about. And besides stress, sleep is super important in regulating cortisol. Without sleep, it is impossible to manage stress and cortisol levels. And that can contribute to more belly fat. Inadequate sleep can also make you more prone to gain weight around the middle because it throws off the balance between the hormone ghrelin, which controls hunger, and leptin, which is the satiety hormone that tells our brain, we don't need another cookie. And look, I am so sensitive to this that even one night of poor sleep and I'm rummaging around in the pantry looking for snacks, which I'm unlikely to find because my pantry has a plan too. Remember, I'm the lady with no willpower when it comes to dieting, so I certainly can't keep potato chips on hand. We'll talk more about that later, but that covers stress and sleep. But did you know that social connections matter too? People with an unhealthy lifestyle who hang out with other people who want to have a hot fudge cake with 3 scoops of ice creams, cherry on top, and a cocktail with every meal are going to face an uphill challenge to maintain a waistline below the danger zone, which remember is 35 inches for women and 40 inches for men. In recovery, they tell you to change your people, places, and things to avoid cravings. Of course, I'm not suggesting that you change your friends, but I am suggesting that you leverage them. Make yourself accountable. Better yet, invite them to join you in your plan to reduce belly fat. What are friends for if we can't talk about it? But here's what I don't want you to do with your friends. Get in the habit of having a drink as the centerpiece for connection. Alcohol, soda, a slushie, sweet tea, all empty calories. Maybe try a sparkling water spritzer instead. You can add cucumbers, strawberries, and limes to make it festive. And don't skip a fun glass. That really adds to the atmosphere without adding calories. And take your friends for a walk. Maybe work up to a hike. Join the gym together. There are lots of ways you can leverage your friends on your journey. Now, there are 2 pillars left, and you've probably figured out what I'm saving for last. But before we get to that, let's talk about fitness. First of all, I need to bust some myths. You can't spot reduce your belly fat with exercises focused on your abdominal muscles. Now, I don't know if that's good news for you or not, but it doesn't work. On the other hand, if you are exercising your abs, quads, biceps, triceps, glutes, or whatever, you are burning calories and, most importantly, you're building muscle. And that's important because the more muscle you have, the higher your metabolism. Remember, one of the reasons belly fat is so stubborn as we age is because we tend to lose muscle mass if we don't hang on to our exercise routine for dear life. Aerobic exercise is important too, but strength training is really key. But you want to know what is king when it comes to comfortable fitting clothes? Diet. Uh-oh, don't forget, I'm the one who can't stay on a diet. Okay, now for some good news. You don't need a diet. You need a plan. And don't think that the plan includes only eating salads, or as my dad used to say, rabbit food. Instead, just eat whole food. Gee, thanks. I know, it's easier said than done for so many reasons. First, what is a healthy diet? Plants. Plants are good for you. Eat them. They're packed with nutrition and fiber. And remember, fiber is only found in plants, and that's what keeps you feeling full and keeps your gut microbiome healthy. Stay tuned, because we are just scratching the surface. But listen, if you eat plants, you don't have to worry about snacking or portion control. Seriously, just eat plants. Trust me, I know it's so much more complicated than eating fruits, veggies, and whole grains and avoiding meat, dairy, and fake food. But for today, this is where we're going to start, because to reach your best healthy waistline, you need fruits, vegetables, whole grains, beans and legumes, nuts and seeds. Because ultra-processed foods, refined carbohydrates, and too much sugar is a growing problem. Yes, I did that on purpose. But packaged foods and restaurant food, it's convenient. And that is the underlying problem. And that's why what you need is not a diet, but a plan. Getting rid of belly fat isn't going to happen overnight. And it isn't going to happen without a plan. But you can do it, and I can help. Healthy Looks Great on You podcast gives you information, motivation, and inspiration, but I'm guessing you need more than that to make real changes that make a difference. You need someone who will come alongside you and help you with a practical plan. This week, I'm sharing a couple of my favorite recipes that are healthy and easy with everybody who's on my email list. Are you wondering if you made the list? Well, if you're on it, you should be getting something in your inbox every Friday, including a link to the podcast. If you signed up and you don't see it, just go to your spam folder, your junk folder, and see if it's there. But if you've never signed up, then now is the time, because I have a plan for you. I have a list of things that you can keep in your pantry and in your freezer to make a quick, healthy, fiber-packed meal in a flash when you haven't planned to cook dinner. Just go to healthylooksgreatonYou.com/pantry guide, because we're going to lose this belly fat together, because it's good for your heart, it's good for your blood vessels, it's good for preventing cancer, and it's good for your brain. We're not talking about appearances, but still, healthy looks great on you.
The information contained in this podcast is for educational purposes only and is not considered to be a substitute for medical advice. You should continue to follow up with your physician or healthcare provider and take medication as prescribed. Though the information in this podcast is evidence-based, new research may develop and recommendations may change.